I was not aware that there was a link between type 2 diabetes and heart disease. Once I learned that, I began to understand a little bit more about my condition. My name is Tom from Buffalo, New York, and I've lived with type 2 diabetes for about 20 years. I live with my lovely wife Val of 31 years, and there's also my 3 children and grandchildren. My love for music runs deep. I've been working in the music business for 40 years. I'm involved in many aspects of the music industry, primarily live audio installations, sound installations, and things of that nature, performance music as well. I was very surprised when I was diagnosed with type 2 diabetes because it had never been discussed before in my health history, and it wasn't really something I was expecting. On my mother's side, my grandmother had type 2 diabetes, and I was not aware of this until I was diagnosed with it. It was not something that was really brought up or talked about. So when I was first diagnosed with type 2 diabetes and then cardiovascular disease, it didn't really concern me a great deal until later on when my doctor explained to me how the two were related and that they needed to be brought under control and monitored. When I was first diagnosed with heart disease, I was worried that I wouldn't be able to do all the things that I normally do. I was concerned about the restrictions and how it would affect my life. So when I was first diagnosed with type 2 diabetes, my doctor had me make some lifestyle changes, which includes medication, exercise, changing my diet. My doctor felt that my current medication was not bringing my A1C down to a controllable levels. Because I have type 2 diabetes and heart disease, my doctor said Ozempic was right for me. My doctor explained how to take it and told me about common side effects.
Ozempic is an injectable prescription medicine used along with diet and exercise to improve blood sugar in adults with type 2 diabetes and to reduce the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes with known heart disease. Ozempic is not for people with type 1 diabetes or children under 18 years of age. It is not known if Ozempic can be used in people who have had pancreatitis. Do not share needles or Ozempic pen with others. Don't reuse needles. Sharing may lead to infection. Do not take Ozempic if you have a personal or family history of medullary thyroid cancer, multiple endocrine neoplasia syndrome type 2, or if you are allergic to Ozempic. Stop taking Ozempic and get medical help right away if you get a lump or swelling in your neck or an allergic reaction.
What motivates me to keep up with my type 2 diabetes plan would be my music activities and being with my kids and grandkids. I want to be active for them and active in the band. I also get a lot of exercise performing with the band. We perform 2 to 3 times a week. It's exercise for my soul as well. My family has been very supportive of my type 2 diabetes journey, and I really appreciate their concern. When my wife and I cook, we make sure that we make modifications that fit in my type 2 diabetes treatment plan. Being on the go, it's very difficult to eat right, but whenever I can, I try to eat vegetables. I enjoy grilling, and my doctor said, well, why don't you try grilling your vegetables? And I'd never done that before other than with shish kebabs, so I decided, all right, well, I'll try grilling that zucchini or that squash next time. Once weekly Ozempic with diet and exercise helped me lower my A1C and even lose some weight. My wife, my children, my grandchildren are large motivation factor for me to stay on track with my type 2 diabetes treatment plan. When my A1C numbers began going down, it was a great motivator to keep me on my treatment plan. I'm even more motivated than ever. I feel like I've started a new chapter and I want to keep going.
Serious side effects may happen, including pancreatitis. Stop taking Ozempic and get medical help right away if you get severe stomach pain. Gallbladder problems may occur. Call your provider if you have symptoms such as stomach pain, fever, or yellowing of the skin or eyes. Tell your doctor if you have diabetic retinopathy or vision changes. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. Taking Ozempic with a sulfonylurea or insulin may increase the risk for low blood sugar. Talk to your doctor about how to prevent, recognize, and manage low and high blood sugar. Common side effects are nausea, vomiting, diarrhea, stomach pain, and constipation. Talk to your doctor about any side effect that bothers you or does not go away. Some side effects can lead to dehydration, which may worsen kidney problems. Drinking plenty of fluids may reduce your chances of dehydration. This video is not medical advice and does not replace the advice given to you by your healthcare provider. Talk to your healthcare provider about any concerns you may have about managing your type 2 diabetes. If you're not reaching your blood sugar goal, ask your healthcare provider if once-weekly Ozempic can help.